This is 7 National News, and in our top story, diseases prevalent in the region are high on the agenda for the health and medical experts at the upcoming Arab Health Exhibition and Congress, which is being held next week. While a diverse range of the latest healthcare products and technology will be widely displayed at the event, organisers say there's also an increase in the number of medical courses being run this year. Diabetes remains highly prevalent in the region, with the UAE ranking the second highest worldwide. According to statistics, 20% of the population suffers from the disease, while 80% are at risk of developing it. Cardiovascular diseases are another concern, and in an effort to complement the ongoing efforts by the government and private sector to combat these diseases and ensure optimal care and results for patients, dedicated medical courses will be among the highlights at the Arab Health Exhibition and Congress. Several topics in focus for the first time include the Middle East Diabetes Conference.
Another area we see a big focus on, and it's one of the conferences that we're proud to present for the second time, is the Wound Care Conference. Mismanagement of wounds creates an enormous burden for the government of the UAE and surrounding region. Millions are spent in treating wounds, which could be managed in a more efficient way. So we're hoping to actually, again, focus on preventive medicine, on cost saving, cost efficiency, to not only improve patient outcomes, but to have the added benefit of reduced government spending, which can then be invested in more worthwhile projects.
Governments in the region continue to invest in order to develop their healthcare sectors from facilities to manpower. And the Middle East healthcare industry is worth an estimated $80 billion per year. Organisers say this robust growth is complemented by the Arab Health Exhibition and Congress, as it reflects the changing trends, needs and demands of healthcare providers, patients and consumers.
There's a huge focus in many of the conferences, particularly in conferences such as diabetes, on preventive medicine, how to educate your patients to actually protect themselves against these preventable diseases. So unfortunately, we have two real categories. We've got preventing the disease for the future and what we can do about the disease now. The need for this conference is really being driven by patients. Statistics show that 1 in 3 patients in the Western medical world are actually seeking complementary and alternative medicine each year. So we're very excited to see this shift away from purely traditional medicine and also looking at complementary and alternative methods of treatment.